Hi, my viewers. I am back with you to discuss my second narrative, the second case history. I hope you had the opportunity of reviewing C1, and if you haven't, then you can cross reference that because that was our first case. This I will call C2, and as you already know, that I am going to de identify. No names mentioned, no institutions mentioned, as you can see in the description box below. And if you read the entire description box, you'll get a better idea. Please do that. So all these are case presentations or narratives, but not in the formal context, not in a formal way of presenting. It is more of a casual, conversational, natural flow of thought. So I hope you will appreciate my second presentation, and that is we will call C2, C for cardiology, and 2 second. So let me start by saying that this gentleman, around 80 years of age, is known to me because of a number of previous follow ups. The two things that always struck me about about this fine gentleman is his smile on his face whenever he entered. And I made a note of it also to him. And the second is his eloquence, his way of speaking, his good language style, and very clear articulation. These two things I remember about him, and it still has remained stuck in my memory. Now let's see what happens. He's a patient who has high blood pressure. Now, this blood pressure of his is reasonably under control. Initially, it was a bit difficult, but we had to play around a little bit with the medication, and we finally got the right formula and the right fix. And he was then on a routine kind of follow up. So, when he came in, I asked him how he was feeling. He says, I'm feeling fine. I said, is there any particular reason that you have come today? He says, no, I've come for a routine checkup. I said, that's fine. So the first thing we did was we took his blood pressure. Now I have to say that I was a little surprised with his blood pressure. Blood pressure was over 200, I think in the 210 range. Can't exactly remember because many years back. And his diastolic blood pressure was in the range of around 110. Now that was steep. And my first thought was to ask him again, are you experiencing anything? He says, no, I'm not. So I said, do you have any headache, any dizziness? He says, no, but why do you ask? I said, no, I'm just asking as a routine. I didn't want to unnerve him. Remember, please, that he is 80 years of age. But the second thought that came into my mind is, of course, we know that sometimes blood pressures of this range can still be silent, important. Okay? So I first wanted to confirm that this was really the reading and went and got another BP apparatus to confirm. The other BP apparatus, barring for some minor differences, confirmed that his blood pressure was raised, was uncontrolled. Now, I was about to go and examine other symptoms, and I have to say also, yes, he was accompanied by his wife. I should have mentioned that earlier. And his wife asks me, is everything all right, doctor? She possibly could see from her vast experience of life that there was something on my face which was possibly revealing something which I didn't want to exactly verbalize. So I was about to go and examine him when suddenly, bolt out of the blue, guess what happened? He started bleeding profusely from his nose. He had a severe form of epistaxis. And if I can recall in my entire 48 years of seeing patients in internal medicine, I have not seen a blood loss of this magnitude. I mean, for me to remember this is etched in memory. And he had actually was profusely bleeding, and his whole shirt, everything was already stained in a few moments and a few minutes. He was having quite a severe degree of blood loss, and you could see from his wife was literally in a state of palpitation and anxiety naturally, and the patient was literally trembling like a leaf. Now, normally one would do a kind of a maneuver if it's a very small kind of epistaxis, that you press the flesh of the nose on either side and pinch it. If it's a small amount of bleeding, you naturally do a little compression on the blood vessel and it will become easier. But here with this kind of thing, one could not take a risk. And at the same time, I thought, should I rush him to the emergency? But the emergency was at least 10 minutes away. And I thought that with this level of bleeding, he would possibly exsanguinate himself or go into a shock or develop some kind of complication. So I asked the nurse, it was a hospital based practice. I asked the nurse, please, next door was an ENT clinic. Now, this was luck. And they managed to send somebody immediately. Now, I can't remember whether it was senior resident, assistant professor, can't remember. But well, he came with his headlamp, which is very important here because he has to see inside and peek inside the nose, if he can see any kind of bleeding point, and he started then to pack it. Now just remember, even I, as internal medicine, cannot persuade myself to do this kind of packing because I must know exactly what I'm doing. And this is the job of the specialist. So if I can't do it, obviously you can't do it on yourself or to anybody else. So the packing was done. It was quite effective. The most of the bleeding was actually over. By the time he started to pack, it started going into a trickle, but still he packed it. And then I took the blood pressure again. And the blood pressure had come down to 140. And it seems that the emergency was practically over. Of course, we did finally send him to the emergency for better care. But before I could send him there, he asks me, I mean, what exactly is happening to me? And he was absolutely in a state of nervousness, as I said, trembling like a leaf. And then he added one more point, which I really remember his sentence. He says, Doctor, why do these things only happen to me? Now, this is actually a common question when a patient has gone into a problem. At which time I relaxed him, I made him feel more comfortable, and then I said what I had to say. I said, you bled from the nose. I'll just put it down very simply. I said, if you had not bled from the nose, you would have bled here. And you would have got a stroke or a hemorrhage, and with very serious complications and consequences. So whatever happened to you for your best. And you see, because you bled, yes, it was terrible. We all felt bad about it. But because of that, your blood pressure had come down naturally. Now, what if this patient actually, with his blood pressure like this, which was obviously like this even when he was coming in his vehicle to the hospital, what if he had bled like this in the hospital, in the vehicle, before coming to the hospital, before coming to me? Time was again of the essence. And the patient automatically appeared extremely appeased that, look, somebody up there looked after me. Now, these are actually profound patient experiences. I would never like to call them interesting experiences because you never like to use the word interesting when it comes to patients, because patients who have problems because they are vulnerable. But nevertheless, they are profound, they're thought provoking. I think that's the correct word. And these thought provoking experiences I would like to convey to you in a simple format. Now, this is actually more for the viewers, but I would also like to add something for the student of medicine, that nature has made what is called the little's area of the nose. The little's area of the nose is anterior and inferior. Anterior means in front, inferior means below. Just at the nasal septum, anterior is in front of the nasal septum, just at the tip of the nasal septum, and nasal septum is the bone over here. And this is a group of very many vessels together converging and covered a little bit very subtly by mucous membrane. So it makes the area extremely delicate. So people who actually pick their nose, they can actually pick that area, and sometimes they develop a little bit of a nasal bleeding. Or sometimes if the air is extremely dehumidified or dry, you can get that thing, as it happens sometimes in the winters. Or sometimes the person does a vigorous kind of nose blowing or a vigorous kind of sneezing, it can rupture those vessels and cause a bleed. Apart from, of course, other conditions like bleeding tendencies and all that, which the medical students would obviously read from a textbook. So this is called the Little's area of the nose, which is also called the Kaiselbach triangle or the Kaiselbach plexus. So this is just for the knowledge of a student of medicine. So what I would like to say in such a situation is, what are the thoughts that come into my mind? One is that a patient can come walking so comfortably with a smile on his face and the eloquence on his lips in spite of a blood pressure this high. So it's not always that a person must have a headache, must have the occipital pain, must have the dizziness. It can sometimes be silent, and therefore it is important to have blood pressure patients have themselves checked with their doctor. That is important. Go to your doctor, get yourself checked, because your doctor is the best judge of everything and will give you the right verdict. The second thing is, sometimes it is also beautifully timed. The fact that he didn't get the bleed in the car or didn't get the bleed while he was at home, his blood pressure was still raised, it was silent. But he had to wait till he came to the hospital, show himself to me, took the blood pressure. It's good also to confirm the blood pressure readings with another instrument, just in case the instrument didn't work properly. It is worth the try, worth the check. And look at the timing. We reached there, we found an ENT next door as a neighbor who came rushing and got his nasal packing to be done so he didn't bleed so heavily. So, all of this, and to know that nature has made that Little's area as a beautiful safety valve, and how the safety valve operated in this patient's case actually saved the life of the patient. Yes, there was a trade off. The trade off was that he bled, and he bled profusely. But the trade off was that he was saved from a massive problem. With a blood pressure this high, just try to think, again for medical students and even for viewers if they're interested in listening, with a blood pressure this high, there is a load on the heart. What our students would like to say, afterload. And this afterload or load on the heart increases the demand for blood going into the coronary arteries. Now, at the age of 80, if the coronary arteries have plaques, which can be silent at this age, and with the high blood pressure as a risk factor, then the supply going to the coronary arteries might not match the demand, and a person can get an acute coronary insufficiency or even a heart attack. Or because of this immense load on the heart can go into cardiac failure. And because of the immense load on the blood vessels to the brain, one of the blood vessels can rupture and cause an intracerebral hemorrhage, or the blood pressure can be so high that it can cause an acute renal shutdown. So, all of these things, our patient, the good old man, the fine gentleman, was completely saved from. So, this is a profound, in my view, clinical narrative executed in a conversational, casual, and non formal style. I hope you enjoyed the experience of listening to me, and thank you as always for smiling with Dr. Ismail. God bless you. Take good care of yourselves. Bye bye.